Welcome back. Joining us now is Vancouver media mainstay, Dr. Art Hister. Hi, Art.
Hi.
Art, thanks for coming on the show today. Our person of the week, John Stufflebeam, is wrestling with celiac disease. What exactly is that?
Celiac disease is a sensitivity to a protein that's found in three common grains, wheat, rye, and barley. But it's actually an autoimmune disorder, and that may be a handful for people, but what it means is that your body responds in a way, it starts destroying itself when you're exposed to whatever it is that's setting off the autoimmune reaction. It's commonly referred to as an allergy to wheat, but it's not a real allergy that way. It's actually more of an autoimmune process.
So what are the symptoms? How do you know you've got it?
Most people don't, and it's one of the most important questions. The symptoms can be terrifically flamboyant. In my case, for example, when I got diagnosed. I love the word, that's all. I know, and it wasn't fun. I mean, you mean it's dramatic. When I was diagnosed, it was, it's TV, but we still have to describe it. I had severe diarrhea, such severe diarrhea that I was literally running to the can every 20 minutes, day and night, 24/7. Yeah, I lost about 40 pounds in the 5 weeks before it was diagnosed. Pain
That's flamboyant. Okay, what else? Maybe
it's subtle. It can be anything. It can be failure. In kids, for example, one of the common symptoms is failure to thrive, or they don't grow as quickly as other kids because they're not absorbing the nutrients because there's this reaction in the gut. Aches and pains. Commonly, people will complain of abdominal symptoms, obviously, because that's where you're trying to digest the factors that you can't deal with.
Okay, so John Stufflebeam was diagnosed pretty late in life. Is that unusual?
You know, it's really appropriate that you ask that now, because just last week, I have no idea when this is going to air, but just last week, a study came out showing that celiac disease actually increases with age, and that it's not uncommon to diagnose it at 65, 70, 75. You may have had it your whole life, that we don't know, at a very subtle level, and it wasn't picked up. Or these people speculate actually that no, it's turned on later in life by whatever factors in the environment are that turn it on. We don't know what those factors are.
Okay, well, John figures that it had to do with intense stress that he had to go through at a time in his life.
Yeah. What always bothers me about that is we can always pick stressful periods in our lives to focus on, and anything that happens at that point, we combine the two. The fact that two things happen together doesn't mean that one causes the other. Can it set it off? Sure. I mean, it makes sense that it could. Is it known to do that very much? No, I don't think so. I would think it's something else. My own suspicion is that perhaps an infection, a mild infection, for example, that you don't pay attention to could set off the immune system and it doesn't respond. I mean, we don't know.
But you want to prevent it somehow still.
Yeah.
What do you do?
We don't know.
Come on.
Don't be born to parents
Throw
who
me
have
a bone.
That. Yeah. No, we have no idea how to prevent it. I wish we did. It would make life so much simpler. Most chronic conditions it's difficult to prevent. It's certainly there's a terrific genetic component. If you're a celiac, the people in your family have a significantly higher risk of having celiac disease, which is a good little pearl for people to pay attention to, because if you've had chronic abdominal symptoms and say your mom was diagnosed with celiac disease, you should put it to the doctor the next time you see me.
Que sera, sera.
That's it.
Yeah, okay.
And you know what? But you really underline for people who are watching that it's real easy to adjust. In many ways, it's a boon, because you start reading labels, you start paying attention to what you're eating, and you'd be amazed at how much healthier you eat once you realize that crap that goes into most of the stuff that's prepared.
And from everything you're telling us, it's quite fashionable. So.
Oh, it is very fashionable.
Okay, Dr. Art Hister, thanks so much.
My pleasure.
North of 49, a guide to the rest of your life.